Looking after your bowels, created by the Pelvic Health Physiotherapy Department. This video is only to be used by patients attending or referred to the Pelvic Health Physiotherapy at Ashford and St. Peter's hospitals. You have been referred to Pelvic Health Physiotherapy to help with the management of your bowels. This video will give you an understanding on how your bowels work and some simple steps to consider to help start to manage them well. You will be followed up on a one-to-one basis with a member of the team to receive tailored care to your needs. In this video, you will learn how the bowel functions, the role of the pelvic floor muscles, the factors that influence the bowel, how to keep a good stool consistency, tips on how to empty your bowels, and other strategies. Food goes through the mouth and esophagus into the stomach. In the stomach, food is broken into smaller pieces and digestive juices are added. The liquid food called chyme moves to the small intestine, where nutrients like fat, carbs, and protein are absorbed. The remaining fiber, water, and waste moves to the colon, where remaining water and electrolytes, which are types of salts, get absorbed and fiber gets broken down via the gut bacteria, as this is not possible in the stomach or small intestine. This process makes the liquid mass into a more formed stool that then exits the body via the rectum. This stool moves into the colon via muscular contractions called peristalsis. The body produces 3 to 4 major peristalsis movements each day. The time food takes to pass the digestive system is called transit time. For most people, food takes 2 to 3 days to get out of the body. The rectum is the last section of the bowel and where the stool is stored before leaving the body. Between the rectum and the anus, there are a series of muscles that maintain the bowel continence and give it support. The internal anal sphincter is controlled by the brain, and it remains closed most times to keep continence. The external anal sphincter is controlled voluntarily and is relaxed most times and works when extra support or continence is needed. The last set of muscles are the pelvic floor, which are a much larger group. They stretch between your tailbone and your pubic bone, also attaching into your 2 sitting bones, forming a bowl shape. They support your pelvic organs in their correct anatomical positions. These include the bladder, bowel, and uterus where it's present. These muscles also provide extra support when you cough, sneeze, or laugh to help prevent leakage from your bowel. The pelvic floor muscles work specifically around the rectum by forming a U-shaped sling that pulls it forward, creating a sharp bend called the anorectal angle. During defecation, these muscles work alongside the anal sphincters by relaxing and lengthen. This allows the anorectal angle to straighten and the anus to open, making the passage easier and allowing the propulsive forces of the abdomen to push the stool out. Stool is initially stored in the lower part of the colon, the sigmoid and descending colon. When the sigmoid colon is full, a strong peristalsis contraction moves the stool to the rectum. Stool causes the rectum walls to distend and the internal sphincter to relax to sample the contents. This allows the brain to know if it's gas or stool. When this happens, the external sphincter contracts to provide extra continence. This action is controlled by the brain and a reflex. If stool is present, signals are sent to the brain to warn the need to find a toilet. If there is a toilet and it's safe to empty, both sphincters and pelvic floor muscles are told to relax and lengthen. If this isn't possible, both sphincters alongside the pelvic floor produce a strong contraction that moves the stool further up the rectum and the urge sensation should subside. It is important to notice that the body will likely absorb further water from the stool as longer as it remains inside, which can cause it to become harder and more difficult to pass. So ideally, it's recommended you answer the urge to open the bowel within 20 minutes. It is normal to open the bowels between 3 times a day to 3 times a week. More or less than that can be abnormal and should be checked. It can take up to 10 minutes for you to open your bowels, so it is important not to rush, as this can cause stool to stay behind and leak later on, or get harder and be more difficult to pass. The frequency that the bowel opens can vary in the lifetime due to many factors, and most people will experience short periods of constipation or looser stools at some point. But sudden changes that persist should be checked. It is not normal to have to strain excessively, to feel like that the bowel has not emptied fully, to need to use a hand to help the stools out, or to lose control of either wind or stool from the back passage. There are a lot of factors that affect our bowel, but not all of them are under our control. The most obvious one is what we eat and drink, which we will go into more detail in the next few slides. How much we exercise has an important effect on the gut, since the bowel is a muscle and more activity and movement helps it work faster and increases the diversity of gut bacteria. As we get older, our gut slows down, so things like constipation can be more prevalent. Mental health conditions and even periods of increased stress can affect the gut motility by either slowing or speeding it up. It can change the gut bacteria, and it can also increase inflammation and sensitivity in the gut, which might cause bloating and abdominal pain. Hormones have a wide and complicated impact on the gut. People with female anatomy are more prone to hormone changes via menstrual cycles, pregnancy, and menopause. Changes to these hormones can happen to everyone. It is worth noting for some people with a neurodiversity diagnosis, such as ADHD or autism, it might feel more difficult to listen to the signals their body is telling them, which can in some instances lead to changes in bowel function. Lastly, some medical conditions and medications can have an impact on the bowel. This list is not exhaustive, so if you feel that you have a medical condition or medication that is affecting your bowel, you can speak to your GP or pharmacist. For optimal bowel function, it's important to aim for 3 balanced meals a day and avoid skipping meals, particularly breakfast, as this will likely provoke the biggest colonic movement of the day. Take time to eat your meals with minimal distraction and chew the food slowly to help digestion and reduce bloating. Remember, chewing is an important part of the digestion process, so if you are having the meal in liquid form, it would also be useful to have something, even if small, to chew alongside this. Try to have high fiber foods in each meal, coming from a variety of food groups for a healthy bowel. If this is something that needs addressing, your physiotherapist will ask more details about your diet during your assessment. One of the main reasons for having issues with your bowels is the stool consistency. If too hard, it can lead to straining, hemorrhoids, and difficulty emptying, and if too loose, it can lead to urgency, leaking, and difficulty cleaning. You should aim for type 3 to 4 stool consistency. Lack of fiber or too much of one type of fiber might be responsible for your hard or loose stools. Having enough fiber is really important to maintain the health of your bowel, as it feeds the gut bacteria, helps bulking and softening the stools, and nourishes the gut lining, preventing inflammation. I have explained why fiber is important, but unfortunately most people don't hit their recommended target of fiber a day. There are 2 types of fiber: soluble fiber, which dissolves in water and gastrointestinal fluids to form a thick gel-like substance. This slows down digestion, and it gets fermented and acts as a prebiotic. It helps constipation by softening and binding stools, and it helps diarrhea by soaking water from the stool, which bulks it and slows digestion. This allows the stool to stay in the colon longer and become firmer. Insoluble fiber doesn't dissolve in water. It adds bulk to the stool, absorbs water into the stool, and speeds up the movement of stool in the gut. It helps constipation by softening the stool and speeding gut movements, and diarrhea by adding bulk to the stool. It is vital to have a mixture of both types for a healthy bowel. You can find soluble fiber in oats, seeds, particularly chia and flax seeds, pulses like beans, lentils, and chickpeas, and the flesh of veggies and fruits like figs, prunes, bananas, avocados, sweet potatoes, and peas. Try to prioritize oat-based breakfasts like porridge, Oatabix, and muesli or granola. Add chia or flax seeds to foods like porridge, soups, yogurts. It is recommended you take 150 milliliters of fluids when having chia or flax seeds. Add lentils, beans, and chickpeas to stews, curries, and minced dishes, and aim to have 2 pieces of fruit a day alongside 2 to 3 vegetables with lunch and dinner. Insoluble fiber can be found in nuts, particularly almonds and pistachios, wheat bran, whole grains like barley, quinoa, or brown rice, the skins of vegetables and fruits, and berries. If you're not allergic, aim to add nuts as snack into yogurts or alongside fruit. You can add quinoa or barley to salads, stews, or soups, and make sure you keep the peel of most of the vegetables or fruits you eat unless you have issues digesting them. All dietary advice given in this video is what ideally works for the general population. However, some people might find due to allergies, access to food, sensory difficulties, disordered eating, and any other influencing factors that this is not always possible. If this is the case, you can discuss this with your GP or physiotherapist to consider anything else that might help. It is important to have the correct amount of fluids for the gut to work well. Everyone is different, but the average recommended amount is 6 to 8 mugs or 8 to 10 glasses of fluids a day, which is the equivalent of 1.5 to 2 liters. Most of it should be water, but all drinks count for your total. If you don't drink enough, it could cause the stools to become harder, but if you drink too much, that could be contributing to looser stools. Be mindful that caffeine drinks like coffee, tea, and energy drinks can stimulate the gut and cause diarrhea. As we have explained, a lot of things can affect your bowels and contribute to irregularities. So trying to establish a good routine can be an essential part of your treatment. The biggest colonic movement happens after waking up. This is because the body responds to a new day by moving waste out to allow space for oncoming food. Try to take advantage of this. Sit on the toilet 15 to 20 minutes after eating breakfast, ideally at the same time each day for up to 10 minutes uninterrupted. However, we know this might not always be the most convenient time, so you can choose another meal time to do this after, if it works better for you. Aim to do this for 6 weeks to help establishing the new habit. Don't strain or force stool out. If nothing happens, move on. For the rest of the day, try to respond to the urge of opening your bowels within 20 minutes. This allows the stool to be at its optimal consistency. When people have suffered with constipation for many years, it is common for some of the signals to open your bowels to get missed and ignored. Try to be more conscious of this. Other strategies can help your bowel functioning better, like regular exercise, good sleep patterns, breathing and mindful exercises, and abdominal massage. Your bowel is a muscle, so movement can stimulate the smooth muscle of the colon, making peristalsis more efficient. If you are unsure on how often and what types of exercise you should do, speak to your physiotherapist or GP. Gut bacteria is directly related to your sleep by producing serotonin and melatonin, the hormones responsible for regulating your mood and sleep. If your gut bacteria is disturbed, you might find it hard to maintain good sleep. On the other side, sleep deprivation can increase cortisol levels and cause gut sensitivity and inflammation. Having bowel issues can cause distress and worries. Alongside the day-to-day stress, you might be experiencing more stress and anxiety than you think. These emotions will affect your nervous system and put your body in fight or flight mode. This is when your body shuts down digestion to send blood to essential organs and turns the pain volume up so you can respond more efficiently to danger. Doing regular breathing and mindfulness exercises helps your body recognize that there is no current emergency and calms the nerves and muscles surrounding your gut. Abdominal massage and heat can be really soothing. It helps bring blood flow to the area, relax the muscles, reduce pain and bloating, and stimulate your gut. Your physiotherapist can advise if this is suitable for you and how best to do it. If you are someone that struggles with constipation or finds it difficult to open your bowels, these strategies might help. It is important to take time every day, ideally at the same time, to empty your bowels. The position you sit to open your bowels is also important. Use a few books, small stool, or roll towels under your feet so your knees are slightly above your bottom. Keep a straight back and lean forwards. When you feel you're ready to open your bowels, expand your tummy outwards like a balloon as you breathe in. Once you have filled your lungs, gently press your tummy outwards as if pressing against a tight belt, and imagine your back passage opening like a flower. This can be tricky to master. Your physiotherapist can help you practice this. Optimal pelvic floor strength and coordination helps to support your bowel, reduce incontinence, and achieve effective emptying. Just like any other muscle in your body, it is important to strengthen your pelvic floor muscles. Initially, choose a position in which you are most comfortable and relaxed, for example, lying down or in sitting. As it gets easier, you could consider trying in standing or with one foot on a step. Doing pelvic floor exercises might not be intuitive to everyone, and you might feel unsure about the correct way to do them. So your physiotherapist will give you more guidance during your assessment. Slowly tighten the muscles around your back passage as if you are stopping yourself from passing wind, then draw forwards as if you are stopping yourself from passing urine. Try to avoid tightening your buttocks, squeezing your legs, or holding your breath. A feeling of gentle tightening in your lower stomach is normal. You might find contracting your pelvic floor muscles as you breathe out helps. Try to complete exercises 1, 2, and 3 to 6 times a day. 1. The muscles need to be able to work quickly and as strong as possible so they can react to stresses such as coughing, sneezing, or running. Imagine the muscles are an elevator, lifting up to the top floor as quickly as you can before relaxing quickly back down to the ground floor. Rest for 2 to 3 seconds before repeating up to 20 times. 2. To help build endurance in your muscles, contract your pelvic floor and hold for as long as you can, then relax and release fully for the same length of time that you held for. Repeat up to 10 times. 3. The muscle around your back passage, called your external anal sphincter, also needs to be able to work at a lower level for longer. This helps to control the passing of stool and wind. Imagine you are stopping yourself from passing wind, but only raise the muscles up halfway. Think about an elevator only lifting up floor 2 out of 4. Aim to hold for up to 20 seconds. Repeat this 5 times in a row. It is important to make sure you fully relax between each repetition of your pelvic floor exercises. For each contraction, aim to give yourself 2 to 3 seconds in between before starting the next one. Remember, it is normal to have short periods of change in your bowel habits. However, if you develop any of the following, you should see your GP as soon as you can. A change from your normal bowel habit that lasts longer than 3 weeks, particularly diarrhea or alternating between soft and hard stools. Persistent pain or bloating in your tummy lasting longer than 3 weeks. Significant tiredness that persists longer than 3 weeks. Increased urinary urgency lasting for longer than 3 weeks. Bleeding from your back passage even if it only happens once. A lump in your tummy. Bleeding after sex, in between your periods, or after your periods have stopped. Unexplained weight loss. Feeling full more quickly or a sudden loss of appetite. These symptoms can have a number of causes, but on occasion can be due to something more serious. So it is important that your GP is aware if you develop any of them. The good news are physiotherapy works for treating bowel health. So alongside this educational video, you will be offered a one-to-one pelvic health physiotherapy appointment to discuss your specific symptoms, treatment options, and answer any questions you have. Thank you for listening.